Well, so the product of the day is pet body insurance. Pet body insurance, you have the idea, this is a product which was launched recently, just 2 months back. And for you, this is a new product. But there is nothing new. This is already there in the market. All companies are selling it. Of course, you have got the idea now after launching of this product. So let us understand what is this product, how we have developed and designed considering the demand of the market. This is pet body insurance policy. Basically, if you have a pet in the family, that pet needs the care like a child. And we do everything we can to take care of these pets. Because we feed them well, we train them well, we provide enough space to them to run and be fit, and show our love and attention to them. So when we are caring these pets like a family member, obviously we need to protect them and need some kind of protection which can provide us the financial assistance in case of any emergency to our pet. So the life and the journey of parenting a pet can be full of uncertainties. Because anytime any sickness, illness, accident, and even theft can take place. Most of the times they are passing through the bad health stage and need the treatment. All those diseases which are normally a person is suffering, a pet can also suffer. So not only the treatment, but for that accident or illness or sickness, some kind of financial help is also required. Because treatment of animals is also costly, because this is being done by the veterinary doctors. They are the special doctors who are treating the animals only, called vet or veterinary doctors. If you have with the occasion to go to the veterinary hospitals, you will find every kind of facilities which are normally you will find in the normal hospitals meant for the persons. So this policy can be bought by any individual who owns a pet. Means only the owner of the pet can take this policy for the financial protection of the pet. And this financial protection is required in order to treat the covered pet dog in the event of any accident or illness. So this accident, illness or sickness is cured and also needs some kind of surgery, some kind of hospitalization, some kind of medicines also. For all these things, financial assistance is required. And that is provided by this pet dog insurance policy. So let us see the coverage of this policy. While designing this policy, 10 sections were provided to cover the risk. 10 individual different sections related to the pet dogs. What these 10 sections are: surgery and hospitalization cover, OPD cover, terminal disease, long-term care, mortality benefit, lost and stolen cover, advertisement and reward, third party liability, and emergency pet care allowance. All these 10 category of benefits are related to the pets. Because claim could be there under any of the one category at a time. Maybe during the policy period, in many categories, maybe 2 claims, 3 claims, depending upon the health and fitness of the pet. So all these sections are the part of the policy. Policy has 10 sections. Let's understand each section of the policy. So the first one is surgery and hospitalization cover. This presentation is visible to everyone, is it? Okay. So the first one is surgery and hospitalization cover. Under this section, the company will indemnify the insured for surgical hospitalization expenses for treatment of insured pet as an inpatient. Inpatient means in case of hospitalization. Now here the sum insured limit is minimum 10,000, maximum 1,50,000. So this sum insured could be in the multiples of 10,000. Surgery and hospitalization of pet whenever advised by the veterinary doctor in case of unfitness or illness or sickness or injury or accident of the pet. And for this section, sum insured is as per the choice of the customer. Sum insured can be opted from 10,000 to 1,50,000, increasing in multiples of 10,000. So sum insured has sufficient amount looking to the valuation of the pet. And especially this policy is designed for the dogs, maybe male or female. So section 1 is surgery and hospitalization, but this section is very wide. Wide in the sense, the coverage provided under this section is very wide and includes many things. Because this is the most important section related to the pet care. What does this section include? Let us see. Surgery and hospitalization can include a veterinarian or vet's fee. Means the doctor who is curing or who is treating the pet is entitled for his fee. No doubt. So this fee amount is payable under the policy also. But the limit is maximum 3% of the sum insured or 3,000 per claim. Means for one sickness, for that the pet is hospitalized or the surgery is done, the veterinary doctor may be paid the fees 1,000, 2,000 or maximum 3,000. That could be maximum 3% of the sum insured or 3,000. This is veterinarian's fee. Second, diagnostic tests. For the treatment, pet may undergo diagnostic tests which may include X-ray, blood test, facial test, pathology test, brain test, MRI, CT scan, ultrasound, etc. So all these things are on the same pattern which are meant for the persons. Only thing is the pet is an animal and the methodology are related to the animals because they can't speak, they can't talk. Veterinary doctors are expert in their treatments because they are studying those subjects which relate to the animals only. The third one is medicines, drugs and consumables. In that surgery or hospitalization, whatever expenditure is done on the medicines, drugs and consumables, that is also part of this section. and payable under the policy. Fourth, payable up to the extent of sum assured. Fourth, surgical procedures. The surgical procedure may include OT, surgeon and anesthetist fees. Anesthetist means who is giving the medicine of unconsciousness for treatment or for surgery, up to maximum of 50% of the sum assured of the section, or up to 50,000 for each claim, provided the sum assured is up to that limit. If the sum assured is less than that, the maximum sum assured will be put there. So that is surgical procedure. For that, this is the limit provided, maximum of 50% of the sum assured, or it could be 50,000 for each claim, if the sum assured is more than 50,000. Next is prosthetics and other devices or equipment if implanted internally during surgical procedure. When the person is treated, certain things are implanted in the body, say like stents or other equipment as per the demand. Similar is the case with the animals also. As per the advice of the veterinary doctors, certain devices or equipment can be implanted internally in the body of the pet during the surgical procedure. The prosthetics and other devices or equipment, whatever is implanted, that cost will also be reimbursed. Intensive care unit charges. Like humans, animals can also undergo an ICU, and the ICU charges are normally higher than the hospitalization charges. So here again, maximum 4% of the sum insured of this section, or up to 5,000 for each claim, is the intensive care unit charge. The last one under this section is room charges or boarding charges. When the pet is hospitalized, maybe in the hospital or in the ICU, room charges or boarding charges are payable up to the maximum of 2% of the sum insured of this section, up to ₹3,000 per day. So all these 7 sections are part of the surgery and hospitalization cover. But in addition, the policy will also provide pre and post hospitalization expenses. Pre means 15 days before the hospitalization. Post means after discharging from the hospital, for next 15 days, whatever treatment, whatever money is incurred on the treatment, drugs or medicines, is also part of the claim policy, because that is covered. So pre and post hospitalization for 15 days each is also covered. The only thing is, there is a provision of copay. Copay means certain amount has to be borne by the insured himself. He is the co-payer in that case, means he will bear that cost. What is that? If the age of the pet is 7 years, up to 7 years, in that case 10% amount will be borne by the insured. And if the age of the pet is more than 7 years, the insured has to bear 25% of the total claim amount. So this co-pay is like compulsory access, we can say, but in a different manner, because in health insurance or medical insurance policies, this terminology is used as co-pay, not the compulsory access. So co-pay means the insured will bear that portion. If the age of the dog is up to 7 years, maybe 1 year, 2 years, 5 years, 7 years, 10% amount of the claim he will be here. Or if it is more than 7 years, in that case 25% amount of the claim insured will be here. So one is the deductible part, other one is the additional part. Additional means pre and post hospitalization charges are also payable, provided they are incurred within 15 days for pre-hospitalization and after 15 days of the discharge of the hospital. So this is a very wide section, surgery and hospitalization cover, and providing a lot of coverages to the pets, because almost everything is covered related to the veterinary fee, diagnostic test, medical drugs and consumables, surgical procedures, anything, device implanted, ICU charges, room charges and boarding charges, almost everything related to a pet is covered under this section. Coming to section 2, that is OPD care. OPD stands for outpatient department. So outpatient doesn't mean only a person can be outpatient, animal can also be. So the outpatient department care is also covered under the policy. Here the coverage is up to 25% of the sum insured of the section 1. What we have just read, surgery and hospitalization. Up to 25% of sum insured of the section 1, subject to maximum of the amount of rupees 30,000 for the following illnesses. So here the maximum limit is 30,000 or 25% of the sum insured. But the good part of the story is 25 illnesses are covered. These all 25 illnesses related to the pet or animals could be there at any point of time during the policy period if the pet is diagnosed with any of them out of these 25. The policy will cover it. So these all 25 diseases relates to the pets, which include to different parts of the pets or the body of the pet, and it could be at any point of time due to unhealthy food, poisonous food, temperature, environmental problems, infections, or there could be any reason. So these 25 diseases mainly relate to the pneumonia, ears, gastroenteritis, meningitis, infections, conjunctivitis, bronchitis, glaucoma. So we are not the person to define all these 25 diseases, but as a matter of coverage, all these 25 diseases are included under the section 2, that is outpatient department care. If the pet is suffering from any of these 25 diseases, the insurance company will indemnify and pay up to the 25% of the sum insured of the section 1 or maximum 30,000 under this head. This is section 2. But at the same time, the policy will also pay the veterinary fee up to 500 rupees for this OPD care, and here again the co-pay is 10% of the claim amount, that is minimum 1,000 on each claim. That means if the claim is filed under section 2, the limit of co-pay will apply 10% of the claim amount, that is minimum 1,000 on each claim. If the claim is filed under section 1, there the co-pay limit will depend upon the age of the pet, and that could be 10% up to 7 years and 25% if the age of the pet is more than 7 years. So co-pay amount will also differ section to section. Coming to section 3, terminal illness. Terminal illness means certain diseases are defined if the pet is suffering with those any of those diseases, the company shall pay the insured the lump sum amount if the insured party is diagnosed as suffering from any of the terminal diseases mentioned below. Here the condition is, once any of these terminal diseases is diagnosed, pet has to survive for 30 days. If the terminal disease is diagnosed and pet died on the 20th day or 7th day or 25th day, the claim under this category will not be paid because the survival period required is 30 days. So what are these terminal diseases? These are 8 specific diseases which relates to the pets. If the pet is suffering from any of these 8 diseases, the claim will be considered under the policy. So what are these terminal diseases? All type of cancer, renal kidney failure, coagulation disorder, cardiac dysfunctions, distemper, leptospirosis, hepatitis, liver failure. You can say in the common sense language, these are the critical diseases. Correct. During the policy period from the date of diagnosis, 30 days survival period is required. Waiting period is not there, survival period is there. So this cover ceased for the lifetime once claimed under the policy. That means if any of the terminal disease is diagnosed, insured has filed the claim under this terminal illness section, insurance company has paid the claim, then this policy will not be given to that pet for lifetime. So this is the condition under this section. This is section 3, terminal illness. Coming to section 4, long-term care cover. Long-term care cover again specifies 8 specific diseases in addition to the terminal illnesses, and these 8 specific diseases are of the nature of long-term care. If the pet is suffering from any of them, any of the 8 diseases, the company shall pay the insured a lump sum amount of 50% of the sum insured, subject to maximum of ₹25,000 if the insured pet is diagnosed as suffering from any of these 8 long-term diseases. What are these long-term diseases? Epilepsy, pancreatitis, Cushing syndrome, diabetes, thyroid dysfunctions, ascites, glaucoma, inflammatory bowel disease. So these diseases are of the nature which needs long-term care. So these are specially designed and covered under a separate category which is known as the long-term care. These are different to the terminal illnesses. Here the diseases are covered, but the claim limit is different. Here the lump sum amount of 50% is payable, subject to 50% of the sum insured, subject to maximum 25,000 rupees. Here again that condition prevails that the cover ceases for the lifetime was claimed under this policy. But the good part is, here this survival period of 30 days is not required, because these are the long-term diseases which are obviously going to be treated for long term. So for example, diabetes is there. If a pet is suffering from the diabetes is not a disease which can be cured in a day, either to the person or to the animal. Pancreatitis, this is not a disease which can be treated in a day. So the long-term care is required. If the claim is paid under any of these 8 categories, this cover will cease for the lifetime. One claim is enough under this policy, provided any of these 8 diseases is diagnosed to the insured pet during the policy period. So the limit of compensation is defined, 8 long-term diseases are defined, and the condition is only one claim is payable. Thereafter, this policy will not be given to the pet. Coming to section 5, mortality cover. Mortality means related to the death. If the pet is dead due to accident or illness, or the vet putting insured pet to sleep in order to alleviate its incurable and inhuman suffering due to an illness or accident. Pet is suffering from such a disease which is incurable, inhuman, that can cause infection to the owner. Veterinary doctor will advise, let the pet sleep forever. They may give some kind of medicine or injection. Let the pet sleep forever, because that has become harmful to the owner, his family, and even the dog is going to suffer the inhuman sufferings. That disease is incurable. So this condition is also covered. Otherwise, if there is a death due to accident or illness, in that case also, the company shall pay the insured the lump sum amount. If death is caused by any disease mentioned in section 4, section 4 is terminal disease. In that case, sum insured payable under this section will not be more than balance sum insured. So whatever sum is paid under section 4, if the pet was suffering with any of these diseases, so the remaining amount can be paid here. Here again, the waiting period of 30 days is there. So mortality cover means now the dog or the pet is dead. So the balance amount of terminal diseases is payable. Otherwise, the waiting period of 30 days will be there. And if that is caused by accident or by illness or by veterinary doctor putting insured pet to sleep, that will also be covered. So this is mortality cover. Coming to 6, funeral expenses cover. Policy also provide for funerals. Now funeral doesn't mean a pyre is there or this dash sanskar is there. It could be in the manner of burial or electric cremation. So for that purpose also the company shall pay 1% of the sum insured, subject to maximum of rupees 1,000 for cost incurred towards burial or electrical cremation. The funeral expenses are also covered. Obviously, this section is after the mortality cover. Because the pet is dead, funeral expenses are also required. Funeral may be in the shape of dash sanskar or burial or electric cremation. Maximum amount is 1,000 or 1% of the sum insured. Section 7, lost and stolen cover. This is a common problem with the pets. Pet can move anywhere without any intimation. There is no system of giving intimation. If the pet escapes, goes beyond the custody of the owner, it is lost. But the condition is If the pet is permanently lost or stolen for at least 90 continuous days, 90 continuous days, that means almost 3 months, then this will be treated as the pet is permanently lost or stolen. It may be taken by someone else, or if it is lost. So in that case, only the company shall pay the sum insured. This has to be proved that the pet is permanently lost or stolen at least 90 continuous days, provided the loss occurs during the birth period. But here one more condition is there. Any claim made after 120 days from the date the insured pet was lost or stolen, the policy will exclude it. This is exclusion. What does it mean? It means, first of all, it has to be proved that the dog is stolen or lost and they have waited for 90 days. Insurance company will agree that the dog is lost now. But for that, two conditions are also there. Within 24 hours of the loss or stealing the pet, matter must be reported to the police within 24 hours. And secondly, insurance company should also be informed within 24 hours from the event of loss. That means, if the insured pet is stolen today, police is intimated, insurance company is intimated. Now the person is trying to recover or find it through police or making his own efforts. Continuously for 90 days he has to wait. Then the company will trust the pet has stolen permanently or lost permanently. Thereafter, within 30 days, he has to process the claim. Because the intimation is already given within 24 hours only to the insurance company. Insurance company has already registered the claim the day it was stolen. Because within 24 hours the intimation has been received. But the waiting period was 90 days to prove that it is permanently lost or stolen. Otherwise, it may be recovered within 15 days, within 1 month or 2 months. So, even if it is not recovered within 90 days, it will be treated as that the property is permanently lost or stolen. In that case, the insurance company is liable to pay the compensation. Insurance company will further provide 30 days to submit the necessary document or to process the claim. If the claim is not processed till 120 days, means 4 months, thereafter the insurance company has got a right to deny the claim, because that is the exclusion of the policy. So all these 3 conditions are important here. Rather 4 conditions. Okay, first of all, 90 continuous days has to be there for treating it that the dog is permanently lost or stolen. Secondly, within 24 hours, the police has to be intimated about the loss or stealing of the dog or pet. Thirdly, the insurance company has to be intimated within 24 hours that the insured pet has been stolen or lost. And the fourth is, after 90 days, within next 30 days, the claim has to be processed. Otherwise, the insurance company may deny the liability. So this is lost and stolen cover. But at the same time, the section 8 says the policy will also pay for advertisement and reward if the dog or the pet has been lost or stolen. Now the owner is making the efforts, and the real efforts come in the shape of advertisements or declaring reward. You must have seen, like the pet is missing, 1,000 rupees or 2,000 or 5,000 or 10,000 will be paid. to the person who is finding the pet or giving the right information about. So that kind of advertisement reward could be declared. But how? The company will pay up to 5% of the pet valuation in the event that the insured pet is lost or stolen for at least 5 continuous days. For at least 5 continuous days, the company will pay up to 5% of the pet valuation in the event that the insured pet is lost or stolen after 5 days. But the condition here is advertisement is permitted in the insured locality. This is not possible that the pet is lost in the Jaipur and the advertisement is given in the newspaper of the Kolkata. No fun. Even the advertisement of that local paper or even pamphlets are required in that particular locality where from the pet is stolen. So the advertisement is permitted in the insured locality only and has received the written approval of the company prior to advertising and for offering a reward for the recovery of the insured pet. So for that purpose this condition is there, that when the pet is lost or stolen for at least 5 continuous days, insurance company is intimated within 24 hours. Insurance company will permit the pet owner to incur 5% of the pet valuation for advertisement or rewards. So this cover is available if you have opted section 7. Means policy provide 10 sections. If this section 7 is taken, that is lost or stolen, then only this advertisement and reward issue will come. So section 7 and 8 will go together. If you are taking section 8 only and not taking section 7, still it is of no use. So 7 or 8 will go together. Section 9, third party liability. Very common section, and this is required for every pet owner. Because the pet is in control, of course, well fed, well trained, but still to any third person at any point of time, if the dog biting case is there, the person may recover the amount for treatment. Person may file a case before the court of law against the owner of the pet, and the court may declare an award of rupees 1 lakh, 2 lakh, 3 lakh to that extent. And this is normal nowadays. So in such a case, company shall indemnify the insured for the legal expenses and cost incurred by him for defending the claim lodged against them to the sum insured as opted by the insured or shown on the policy schedule against this section. So any kind of legal liability arises due to the pet biting or even scratching is covered. So this liability will be paid by the insurance company under section 9. Coming to section 10, emergency pet care allowance. Say suppose I am living alone, I have my pet, I fall sick, I am hospitalized. Now who will take care of my pet? In that case, I am arranging some caretaker who will take care of my pet. So for that caretaker I have to pay amount. So this amount, a daily allowance of 1,000 per day, up to maximum of 4 days towards the cost incurred towards engaging a pet caretaker, is also payable under the policy. If insured or a member of the insured family is required to be hospitalized for more than 4 continuous days on the medical advice of the medical professional, in that case only this pet care allowance will be payable. The person himself is hospitalized for more than 4 days. He has hired a pet caretaker. For him, 1000 rupees per day will be paid, maximum for 4 days. This emergency pet care allowance section is also there. Now, policies for dog owners only. Person owns a pet and would like to have protection against various expenses that may be incurred in order to treat the covered pet dog in event of any accident or illness. The only object of taking this policy is that to get the protection against various expenses. Now, what is the eligibility of pet to insure? There are breeds of the pets and the age. So veterinary doctor is the person who will tell what is the breed and what is the age, what is the age of the pet. Insured has to select any two sections, whereas section 1 is mandatory. Section 7 and 8 should be selected together. So this breed has to be certified by the veterinary doctor. There could be breed like giant, small, medium and large. So in case of giant breed, who are normally hunter dogs, entry age is 3 months to 4 years. A giant breed pet of 4 months or 3 months can be insured, but that will be insured only up to the year of 4 years. Only up to the 4 years. If that giant breed pet is more than 4-year old, 4.5 or 5 or 6, the policy will not be given. Once the policy is taken before the completion of 4 years, it can continue till 7 years. Exit age is 7 years. Thereafter, the policy will not be given. In case of giant breed, but for small, medium, and large breeds, 3 months to 7 years. Policy can be given up to 7 years, starting from 3 months. And policy can continue till 10 years. Because normally the age of these small, medium and large breed pets is 10 years, 10, 12, that's all. So entry age, exit age both are defined. Breed of the pet is defined. It could be giant, small, medium and large. Mandatory conditions is policy has the 10th section. Insured has to select minimum 2 sections. And out of those 2 sections, section 1 is mandatory, because this section 1 is the section which relates to the surgery and hospitalization and all kind of medical benefits which are payable under section 1 only. So there is real or the basic coverage, that the core benefit of this policy is in section 1, that is mandatory. If the insured is selecting more than 2 sections, he is allowed to select all 10 sections also. But while selecting more sections and taking section 7, in that case the condition is this, that section 7 and 8 will go together. These sections have to be selected together, because section 7 relates to the lost and stealing of the pet, 8 relates to the advertisement and reward. So advertisement and reward arises only in case the pet is stolen or lost. So both sections are required simultaneously. Now how the premium will be charged. So this is to be understood. 10 sections are there. All 10 different sections are there. Section 1 is mandatory only. Policy can be given on selection of 2 sections only. Feasibility is there. Customer can select any number of sections or even all 10 sections. Premium is chargeable as per the breed of the pet. And breed is defined in 4 different categories: small, medium, large, and giant. And the entry age or exit age are different for all breeds. For example, for a small, 3 months to 4 years, 4 years to 7 years, and 7 to 10 years. Because small, medium, and large pets can be insured up to 10 years. So 3 different columns will decide the premium rate. Similar is the case with medium. Similar is the case with large. But with giants, the case is different. Because here maximum entry age is 4 years only, and the policy can run up to 7 years old. The premium rate is given in per milli, per thousand. Sum insured would be in multiples of 10,000. It may start from 10,000 to go to maximum 1,50,000 in multiples of 10,000. Premium rate will be charged per thousand. We are entitled to give direct discount 15%. So policy is again in very clear terms. Section 1 is mandatory. Minimum 2 sections are required. All 10 sections are available. If the insured is selecting section 7, he has to select section 8 also. Section 7 or 8 will go together. Premium will be charged according to the breed of the pet. Breed is divided into 4 categories: small, medium, large, and giant. Entry age and exit age are defined clearly. For small, medium, and large, entry age is up to 10 years. For giants, entry age is up to 7 years. So this is the premium chart. Thereafter we comes to key features of the policy. But with those key features, this is providing the limits for everything, section wise for all 10 sections. Thereafter, this requirement is important to understand. When you are insuring a pet, what do you need? At that time you need the detail in the proposal form, plus photo or video of the pet, plus a valuation certificate from the veterinary doctor, plus age. So valuation certificate will show the value of the dog. Age proof will show the age of the dog or pet. Premium will be charged on that basis only. Pet photo or video is required for the case for identification. Reason being, pets are not tagged. If you will see the cattle insurance policy, other cattle are tagged in the ear. It could be a metallic tag, it could be a plastic tag, but tags are there. And that tag is the only way out to identify the insured cattle. But here, no tag is installed in the ear of the dog. No identification there. The owner may have the name of the pet, but that name is not the identity. Name could be similar for 5 pets, 10 pets. So that pet will not be the identity. There is no other ID proof. So just for the identification of that pet, a pet photo or a video is required along with the proposal form. Additional evaluation certificate and age proof. You know, maybe some of you are already having the pets. Whoever is having the pet, they always have to consult with the veterinary doctor for every purpose. Because that is the person who will advise you the correct age of the pet, value of the pet, fitness of the pet, breed of the pet. So these are required because on the basis of the age and value, the premium will be calculated. On the basis of the certificate of the vet, the policy will be accepted. So these are the basic requirements to issue this policy. Now insured right to select minimum two sections. Section 1 is mandatory. Section 7 and 8 will go together. Payout for this policy is 25%. Product PPT, policy wording, proposal forms are already sent to all concerned. If you have not received, you can directly send a mail to the underwriting department. You can directly get it from the underwriting department. The product is live in Nova CVS and branches can issue policy through their end. So at the branch level also the policy can be issued. It is live on Nova CVS. Payout is 25%. Only thing is the insured must select minimum two sections. If the section 7 or 8 are selected, in that case, this both should be there. Otherwise, the choice depends upon the insured. He can also select all the 10 sections. So this is all for the day. Now if you have any questions, you can ask me.